Hi friends, welcome to the channel, The Nurse. Here we are discussing about Navodaya Vidyalaya Samiti, female staff nurse exam practice questions. In this video, we will discuss nursing questions, general awareness question, general English and Hindi questions. Also, there will be reasoning questions also. So please stay tuned till the end. There will be 27 questions in this video. So sometimes video may be a bit longer. So stay tuned. If you are not subscribed our channel, please subscribe. Don't forget it. And we will move to our topic, Navodaya Vidyalaya Samiti practice questions. Navodaya Vidyalaya Samiti exam practice test. It includes general awareness, nursing, English, Hindi, aptitude questions. First question. The calcium channel blocker most likely to suppress the tachyarrhythmias involving AV node is. The calcium channel blocker most likely to suppress the tachyarrhythmias involving AV node is. Correct options: verapamil, nifedipine, amlodipine, nicardipine. First question. Please try to answer, then only we can make the video session active. Good evening, Vasant. So first question answer is verapamil. Verapamil, it blocks most likely to suppress the tachyarrhythmias involving AV node. So I will give you a brief explanation about calcium channel blockers. The calcium channel blockers are the medications used to lower the blood pressure. Calcium channel blockers used to lower the blood pressure or used for the hypertension, treatment of hypertension. The calcium actually, why calcium entering into heart muscles cells or arterial wall cells, and it will promote the contractions. It will promote the strength of the contractions. But the calcium channel blocker medicines will prevent the entering of calcium into the heart muscles or arterial wall muscles. Then it will cause relaxation of the blood vessels or relaxation of the heart muscles. That way it will reduce the blood pressure. Once again I will tell, the calcium channel blocker used to reduce the blood pressure, and how it is working like the calcium usually it will enter into the cells of the heart and arteries, and it will increase the strength of contraction. By calcium enters into the heart and arterial cells, and it will helps to increase the strength of contraction. But the calcium channel blocker will prevent the entering of the calcium into the heart and arterial walls. Then like that it will make the arterial wall and the heart become relaxed. That way the hypertension will reduce. Second question. The primary goal of glucocorticoid treatment in rheumatoid arthritis is. The primary goal of glucocorticoid treatment in rheumatoid arthritis is reversal of the degenerative process, suppression of inflammation, development of a sense of well-being, eradication of all symptoms. The primary goal of glucocorticoid treatment in rheumatoid arthritis. Please, those who are in live, please try to answer, then only we can make active session. Correct answer is suppression of inflammation. The glucocorticoid used in rheumatoid arthritis is for suppression of inflammation. Third question. A patient is receiving aminoglycosides for 10 days. The nurse should monitor the patient for. a patient is receiving aminoglycosides for 10 days, the nurse should monitor the patient for hepatotoxicity, symptoms of gastric irritations, nephrotoxicity, visual disturbances. Aminoglycosides examples includes gentamicin, amikacin, tobramycin, neomycin, and streptomycin. If we are using aminoglycosides for longer time, it will cause one major side effect is ototoxicity. Along with that, one more toxicity is there, that is nephrotoxicity. Aminoglycosides will cause ototoxicity and nephrotoxicity while using longer terms. Aminoglycosides are class of antibiotics used mainly in the treatment of aerobic gram-negative bacilli infections. Aminoglycosides are class of antibiotics mainly used for the treatment of gram-negative bacilli. They are also effective against bacteria including Staphylococci and Mycobacterium tuberculosis. They also often other antibiotics. Main purpose of main use of aminoglycosides, that is for against gram-negative bacilli. It also effective as against other bacteria include Staphylococcus and Mycobacterium tuberculosis, and it can also used along with other antibiotics. Examples I already told: amikacin, streptomycin, tobramycin, neomycin, etc. are the examples of aminoglycosides. Then fourth question, the researcher want to generalize the study findings to target population, accessible population, sample, individual. This question is from nursing research subject. The researcher want to generalize the study findings to target population, accessible population, sample, individuals. Correct answer option A, target population. Target population means it is the total group of individuals from which sample might be drawn. The target population is the total group of individual. Target population means total group of individual where sample has taken. Sample means it is a group of people who take part in the investigation. That is the main difference. Target means that is a total group of a particular individual. Sample, in the same time, sample means some particular number of people taken from the target population to represent the target. For example, for a 10th class, we need to do a research in the 10th class students. So 10th class student, all the 10th class students are target population. In the same time, we will pick 10 or 20 students as a sample. That students represent whole 10th class students. That is the difference between target and sample population. Fifth question, which among the following is not a probability sampling technique? Which among the following is not a probability sampling technique? Systematic sampling, stratified sampling, quota sampling, cluster sampling. This question also from nursing research subject. In the sampling technique, there is mainly the sampling technique is divided into probability sampling and non-probability sampling. In this question, it is clearly asked which is not included in probability sampling. Probability sampling also subdivided into different sampling techniques. In that, which one is not included in probability sampling? Fifth question. Correct answer here, option C, quota sampling. Quota sampling is an example of non-probability sampling. Quota sampling is an example of non-probability sampling. In the same time, Probability sampling includes systematic sampling, stratified sampling, cluster sampling, multi-stage sampling also included in probability sampling. But quota sampling is not included in probability sampling. It is an example of non-probability sampling. Sixth question. Which among the following is a measure of dispersion? This question is from Nursing Statistics. Which among the following is a measure of dispersion? Arithmetic mean, geometric mean, standard deviation, median. Which among the following is a measure of dispersion? Correct answer is standard deviation. Standard deviation is the most commonly used measure of dispersion. It is a measure of spread of data about the mean. Standard deviation is the most commonly used measure of dispersion, and it is a measure of spread of data about the mean. Seventh question. Nurse monitor a patient during the oliguric phase of acute kidney injury for all the following except. The nurse monitor a patient during the oliguric phase of acute kidney injury for all the following except seizures, hypokalemia, metabolic acidosis, azotemia. The time of oliguric phase given most of the all given options are there except one of the option. Oliguric phase means the person has urine output that is less than 400 ml per day or more than 100 ml urine. The urine output between 100 ml to 400 ml per day, then it is called oliguric phase. If it is below 100 ml, then it is known as anuria. So oliguric phase, there will be seizure, metabolic acidosis, azotemia. Hypokalemia is not seen in oliguric phase. Instead of that, there is a chance of getting hyperkalemia there. Oliguric phase, there will be seizures, metabolic acidosis, azotemia, and hyperkalemia instead of hypokalemia. Oliguria means the urine output less than 400 ml or more than 100 ml. Eighth question. One should ensure the following for an informed consent except. One should ensure the following for an informed consent except competence of the researcher, voluntary participation, comprehension, information. Eighth question. One should ensure the following for an informed consent except. This question is from nursing research topic. Correct answer here, competence of the researcher. One should ensure the following for informed consent except competence of the researcher. Ninth question. Nurse's responsibility while caring a patient during and after barium swallow include the following except. Nurse's responsibility while caring a patient during and after barium swallow include the following except administer laxative and enema in the evening before procedure, NPO for 8 to 12 hours before procedure, avoid smoking, increase fluid intake after the study. Here the nurses plan to administer barium swallow. barium solo study actually usually doing to diagnose any problem or any disease condition in the upper GI tract. If there is problems in lower GI tract, barium enema usually administered, but here it is giving barium solo. So mostly the doctor is planning to diagnose any problems in the upper GI tract. Here correct answer is administer laxatives and enema in the evening before procedures. Administer laxatives and enema in the evening before procedures. Because barium solo, it is not required laxative and enema in the evening before procedure. But in the case of barium enema, the evening of the procedure, that previous day evening, we need to administer enema. But in the case of barium solo, it is not required. 10th question. Cost related to loss of work due to illness and hospitalization is termed as. Cost related to loss of work due to illness and hospitalization is termed as direct cost, indirect cost, intangible cost, fixed cost. This question is from nursing management subject. Cost related to loss of work due to illness and hospitalization is termed as. Correct answer, indirect cost. Cost related to loss of work due to illness and hospitalization is termed as indirect cost. 11th question. The Revolutionary Women and Child Health Campaign GOBI-FFF is formulated by. The Revolutionary Women and Child Health Campaign GOBI or GOBI-FFF is formulated by WHO, UNICEF, UNESCO, USAID. Correct answer is UNICEF. The Revolutionary Women and Child Health Campaign GOBI-FFF is formulated by UNICEF. GOBI-FFF means growth monitoring, oral rehydration, breastfeeding and immunization, and female education, family spacing, and food supplementation. Once again, GOBI-FFF means growth monitoring, G for growth monitoring, O for oral rehydration, B for breastfeeding, I for immunization, F for female education, second F for family spacing, third F for food supplementation, are selective package of World Health Organization primary healthcare strategies recommended by UNICEF. Twelfth question. All of the following are patient's responsibilities except. All of the following are patient's responsibilities except providing information, complying with instructions, give different kind of care, following hospital rules and regulations. In this question, patient's responsibility asked here. In this question, patient's responsibility asked. Correct answer here, option C, give different kind of care. Neha Loyal, Anita Meena, Said Nikhat, Dayamani, etc. are given. Correct answer here. Keep it up. Next question. Changes that occurs in the musculoskeletal system due to immobility. Changes that occurs in the musculoskeletal system due to immobility. Decrease muscle endurance, strength and mass. Change in calcium metabolism with hypercalcium results in renal calculi. Alteration in calcium, fluid and electrolytes. None of these. Due to prolonged immobility, uh, leads to changes that occurs in musculoskeletal system. Changes that occurs in the musculoskeletal system due to prolonged immobility. Decrease muscle endurance, strength and mass. Change in calcium metabolism with hypercalcium results in renal calculi. Alteration in calcium fluid and electrolytes. None of these. Most of you given correct answer, that is option A. Decrease muscle endurance, strength and mass due to the prolonged immobility. Fourteenth question. The age of administration of inactivated polio vaccines. The age of administration of inactivated polio vaccine or IPV. 6 weeks and 10 weeks, 10 weeks and 14 weeks, 6 weeks and 14 weeks, 9 months. The inactivated polio vaccine is administered into which age group of children? Fourteenth question. Correct answer is option C, 6 weeks and 14 weeks. The inactivated polio vaccine is administered at 6 weeks and 14 weeks. 15th question. The route of administration of measles vaccines. The route of administration of measles vaccines. Fifteenth question. Route of administration of measles vaccine. Intradermal, intramuscular, subcutaneous, oral. It is a repeated question. I think most of you know about the correct answer. That is option C, subcutaneous route. Measles vaccine is administered through subcutaneous route. So next we will move to general awareness question. General awareness question. First question. Tellicherry breed which was seen in the news is a registered native chicken breed of which state? Tellicherry breed which was seen in the news is a registered native chicken breed of which state? Tamilnad, Karnataka, Kerala, Andhra Pradesh. Tellicherry breed which was seen in the news is a registered native chicken breed of which state? Correct answer is option C, Kerala. 17th question. Tequila fish which was declared extinct has been reintroduced to which country? Tequila fish which was declared extinct has been reintroduced to which country? Brazil, Mexico, Germany, China. Tequila fish. Correct answer is option B, Mexico. Tequila fish which was declared extinct but has been reintroduced to Mexico. 18th question. 18th question. Which football legend's statue has been unveiled in Panaji, Goa? Which football legend's statue has been unveiled in Panaji, Goa? Sunil Chetri, Bhaichung Bhutia, Cristiano Ronaldo, Lionel Messi. In recently, which football legend statue has been unveiled in Panaji, Goa? Sunil Chetri, Bhaichung Bhutia, Cristiano Ronaldo, Lionel Messi. Correct answer is option C, Cristiano Ronaldo. Correct answer given by Suresh Pujari, Mary Julie, Priya Kamal, Chunchun Kumari, Neelam Chukar. So keep it up. Next question. The Indian Army's Quantum Computing Laboratory and a Center for Artificial Intelligence. The Indian Army's Quantum Computing Laboratory and a Center for Artificial Intelligence has been set up in which state? Gujarat, Bihar, Uttar Pradesh, Madhya Pradesh. The Indian Army's Quantum Computing Laboratory and a Center for Artificial Intelligence has been set up in which state? Correct answer is Madhya Pradesh. It is located in Madhya Pradesh. 20th question. Which payments bank has been granted the status of a scheduled bank by the Reserve Bank of India? Which payment bank has been granted the status of a scheduled bank by the Reserve Bank of India? Airtel Payment Bank, Aditya Birla Payment Bank, NSDL Payment Bank, Jio Payment Banks. Which payment bank has been granted the status of a scheduled bank by the Reserve Bank of India or RBI? Correct answer given by Anita Meena and Ali Lenthang. Only two people given correct answer here. 21st question. This question is from a general English topic. So answer it by reading it. It is a general English question. The chairman is ill and we will have to dash the meeting for a few days. The chairman is ill and we will have to dash the meeting for a few days. So in this area, you need to give a proper word from the option. Put on, put off, put away, put off. The blank area should give a word like word giving meaning of postpone. Correct answer is put off. The chairman is ill and we will have to put off the meeting for a few days. Put off means to postpone for some days. Same time, put on means while wearing the dress. That and all meant by put on. Get dressed in, switch on, turn on, etc. are the meaning of put on. First word. Put off means there is no such kind of term. Put away means something we are storing or something we are saving. In that meaning, we can use put away. Or sometimes if some person is consuming more amount of food and drinks, then that meaning also we can use put away. Put off means here it is meaning is postpone something. Next question, that is also from general English. Find the word which is spelled correctly from the given words. So in these words, which one is correctly spelled? Incambant. So some spelling mistakes are there. Only one word is correct here. Second question. Correct answer here, option fourth. Option fourth is correctly spelt word. Incumbent. Incumbent means a person who is currently in an official position. So for an example, the present incumbent of the Rashtrapati Bhavan is Sri Ramnath Kovind. The present incumbent of the Rashtrapati Bhavan is Sri Ramnath Kovind. 23rd question, that is also from General English. Find the correctly spelt word. Find the correctly spelt word. Profession, that is, which one is correct spelt word? So this is a common using word. Profession, 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 Profetion. Correct answer is option C, profession. Here one F is there and double S. Profession. 24th question, that is from General Hindi subject. The question is, हिंदी की विशिष्ट बोली ब्रज भाषा किस रूप में सबसे अधिक प्रसिद्ध है? हिंदी की विशिष्ट बोली ब्रज भाषा किस रूप में सबसे अधिक प्रसिद्ध है? राजभाषा, तकनीकी भाषा, राष्ट्रभाषा, काव्य भाषा. 24th question from General Hindi. हिंदी की विशिष्ट बोली ब्रजभाषा किस रूप में सबसे अधिक प्रसिद्ध है? Correct answer is option D, that is काव्य भाषा. हिंदी की विशिष्ट बोली ब्रजभाषा काव्य भाषा रूप में सबसे अधिक प्रसिद्ध है. 25th question also from General Hindi. ब्रजबुली नाम से जानी जाती है. ब्रजबुली नाम से जानी जाती है पंजाबी, मराठी, गुजराती, पुरानी बांग्ला. 25th question also from General Hindi. ब्रजबुली नाम से जानी जाती है पंजाबी या मराठी या गुजराती या पुरानी बांग्ला. Correct answer here, that is option D, पुरानी बांग्ला. ब्रजबुली नाम से जानी जाती है पुरानी बांग्ला. Next question, that is from reasoning. Find the odd word or letters from the given alternatives. Find the odd word letters from the given alternatives. Swimming, sailing, diving, driving. This question is from general reasoning question. Odd one out, that kind of reasoning question. So I will tell the answer, but you need to tell the reason. Correct answer is driving. So can you tell the reason for driving is the odd one? Driving is the odd one among the other options. Why it is? Some of you commented driving. Can you please give the reason? Saida Nikat given correct answer because first three related to water. Driving is odd one. So like that you need to answer these kind of questions. You need to find out the relation with other options and you need to remove the odd one. Okay, Anu Devi, Agnes Boyer, etc. are explained the reason. Keep it up. Driving means that is through road. So swimming, sailing and diving and etc. are used in water, related to water. 27th question, last question of today's video. That is also from reasoning. Find the odd number from the given alternative. Find the odd number from the given alternative. This question, I think you need a little more time. 5720, 6710, 2640, 4270. In these options, one number is odd one. You need to remove that odd. You need to find out the odd one. There will be some relation with other options. One of the number is not related to others. This is our last question. And one more thing, while giving answer, you need to justify your answer by giving a proper reason. So most of you commented A, B, C like commented, but can you please tell the reason for that your answer? How you find out your answer is correct? Somebody please explain how you got the answer. Please explain answer. How you got this answer? Okay, I will explain it. First number is 5720. So we can see 5 plus 2, that is 7, middle number. 5 plus first number plus third number, that is middle number. Here also first number plus third number, that is middle number. 6 plus 1, that is 7. Here also 2 plus 4, that is first number is 2, third number is 4. 2 plus 4, that is middle number. In last option, that is first number is 4 and third number is 7. 4 plus 7, that is 11. But here middle number is 2. So this is the odd number here. So correct answer is option D, 4270. Because there is no relation with the numbers. So once again, the option A, that is first number plus third number, that is middle number. 5 plus 2, 7, that is the middle number of first option. And the second option also 6 plus 1. 6 is first number, 1 is third number. So 6 plus 1, that is middle number. Option C also, it is like same. First number is 2, third number is 4 and second number is 6. First number and third number addition, that is 6. So like that, there is no relation with the fourth option. 4 plus 7, that is 11. But here in this option, the second number is 2. So there is no relation with other options. So we can identify this is the odd number here. So I think it is clear here. So that is about today's video. So if you like this video means please share with your friends and tell them to subscribe our channel, The Nurse. So we will discuss more video in coming days, and keep watching and stay tuned. And if you find any difficulty or any confusion or anything is not clear, then please comment in comment section. So I will try to clarify your doubts and your doubts. So thank you for watching this video, and I enjoyed your active participation and keep supporting in upcoming videos also. Bye bye.